Hi, everybody. Welcome to the ReByrth podcast with Urban Baby Beginnings. My name is Miss Jalen Brown, your host, and today we'll be talking with Stephanie Spencer, the founder and CEO of Urban Baby Beginnings. Stephanie, tell us a little bit about yourself.
Sure. I am a mom of three. I am a registered nurse by training. I have also many years in the corporate structure as a supervisor and manager with Fortune 500 companies. And most of my work has been on building infrastructure and systems to strengthen communities, more specifically in the maternal health space.
Amazing. So, with your experience as a registered nurse and working in the maternal health space, what would you say about the state of maternal health right now?
I think obviously, if we talk nationwide, we are still having many challenges with moms and babies and their outcomes overall. Mm-hmm. We're still seeing high preterm birth rates, infant and maternal loss. And as a result of that, I think that it's really caused us to really think and rethink about how we're providing care for women, birthing people, and babies. In Virginia, we're seeing a lot of strides being made to improve outcomes. We've seen mortality rates for women start to drop, but concurrently seeing increases in infant mortality. So we still have a lot of work to do. And I do believe that we have a lot of committed people who are really trying to achieve the goals that we've all set and that the mothers have challenged us to meet.
I remember us having a conversation recently about the lowering of maternal mortality. What do those numbers look like right now?
I want to elevate that it's important to recognize that our goal for maternal death is 0. Yeah. And we're at about 14 right now within the last year. And so we are making great strides. We've seen that by working collectively together that we can reduce mortality rates for mothers and those preventable deaths as well. But that really starts with us elevating the causes of maternal death and really working towards addressing the barriers that contribute to that.
Yeah, absolutely. And for those of you who are listening, that 14 is coming down from hundreds, right, in the past few years. So that's huge. Mm-hmm. That's huge. Absolutely. So with Urban Baby Beginnings, the work that we do, how do we inform these changes within the community?
We've been around for 3 decades now, so a really long time, hitting 35 years of work in the community. And we, in 2015, really started looking at how do we create infrastructure and systems of care that are really based in the community level and led by community organizations such as Urban Baby Beginnings. And, one of the things that we've really tried to work on is making sure that moms and dads and caregivers know where to go when they are either working with someone who may be pregnant or postpartum or themselves may be that. And so at Urban Baby Beginnings, our maternal health hub system really connects mothers and families to local perinatal health hubs. And that's really important because what it allows for us to do is to get concentrated voices together to inform the work that's actually happening. And so in 2018, when we really started this ride of being alongside of state agencies and legislators who are all interested in improving maternal health outcomes, we were then able to really bring our mothers to the forefront and their caregivers and fathers to say, our voices matter. And these voices are most important when we're informing strategies to make improvements. And so that's really our work is, making sure that community stays at the center. Yeah. And, through everything that we do, remembering the legacies that we have over hundreds of years and how they've transformed levels of care and how we've kind of stepped backwards, in forgetting that community really does work hard to try to make sure that, no one's falling through the cracks, and we can't neglect that. And, for a long time, I believe that we had gotten away from, really putting our moms at the center.
Absolutely. Yeah, I completely agree with that. You talk about this maternal hub system, right, and having local perinatal health hubs. There's this natural, well, there's this issue within each community, or there are specific barriers within each community. And, as we're within this system, of course, we want things to look similar and consistent across all hubs, right? But we can't always do that because we have funding barriers. We have, people in the community who have their own kinds of barriers. So what does that look like, and how does Urban Baby Beginnings address that?
Yeah. So as we've really tried to strengthen this system of care, this infrastructure, we have recognized that there are some things that baseline across all hubs that are a necessity. Moms are stating that they need social support. They want to be able to have, at the touch of a button, someone that's able to provide advocacy and resources and connections without, having to figure it all out themselves through all the papers they're getting. And they need someone to be able to provide information in a way that makes sense to them at the time that something's happening. So whether that be lactation support or providing information about how to put together your birth preferences, as you're trying to enter into the hospital, or just basic information. And there are many other things. But in that same token, by region, by locale, we do see that there's some additional issues that we need to be able to address. And so what we've done here is bring together multiple individuals who create our interdisciplinary teams and help to inform our work alongside of our mama family councils. And they work together to help identify where our barriers and gaps are so we can ensure that we either have partners that can take the place of the gap that's there, to make sure that we fill that in. Or also, too, that we utilize their voices to help us with creating legislation, that helps us to move the work forward.
Absolutely. Absolutely. So in relation to the maternal health hubs and perinatal health hubs, not all of our listeners are going to know what perinatal even means, right? So can you define those two things for our listeners?
Sure. So perinatal is really that time from pregnancy to the first year postpartum. Maternal is any person that has carried a baby or has a child.
So that includes people also with loss.
Yes, absolutely. Exactly. And I think it's important for our listeners to understand that we really feel that from a maternal side, that everyone needs care for the length of, for their lifetime, right? And so that doesn't stop at 1 year postpartum. And we also know that when we as mothers are supported from pregnancy to maybe our next pregnancy and down that line, that each time we carry and have a new baby, that we do better. And so we can't withdraw supports just because we've hit that 1 year mark. So that's why we really focus on the maternal health hub system of care and all of the things that happen, including, pregnancy, including loss, and also including early childhood. So when we have our babies too.
Awesome. Amazing. So a huge part of motherhood, as we all know, is mental health and ensuring that our moms are supported, not only by their families, but by their community. And like you said, community voices are the most important in making sure no one falls through the cracks. So how at Urban Baby Beginnings are you ensuring that moms are getting that mental health support?
Yeah, a couple of things. So just one, getting mental health support is something that still remains very taboo for many people, right? So when we say that it should be normal practice that you have a therapist, many people will shy away at that because we're still trying to change that culture. But there's something to be said for social support networks that are more informal that help to also address and connect people with having the mental health supports that are necessary. So there are layers to mental health supports. There's just having that sense of belonging and being in a space and communing with other folks who, are going along the same journey as you.
Yeah.
And that in itself is very informal. But when we recognize that, about 40% of our moms really do need some additional levels of care, it it becomes a responsibility of us to make sure, of Urban Baby Beginnings and others, to make sure that we are able to connect. So in the last several years, we have focused on, as a state, improving access to mental health care. Aside from our social support groups, we have partnerships with It Takes a Village, which is a partnership with around either 6 to 8 partners who are also doing this work to make sure that there's no barriers to getting mental health supports for mothers. And then we're also working on continuing partnerships as well to expand access not only to mental health supports with licensed clinical social workers, but also ensuring that people have med management, as well. And so, we hope in the next year to really see this continue to build. As we realize that mental health crises continue to increase, our goal is to get more upstream so that we can start to get those numbers down.
Yeah, absolutely. And you talk about mental health numbers increasing. We also know that cardiovascular numbers are increasing. So can you speak to cardiovascular health in relation to maternal mental health?
There's a lot to be unpacked in relation to mental health, cardiovascular health, the importance of healthy nutrition and all of that, and how that all kind of relates with one another. But we are seeing our cardiovascular numbers and our mental health numbers continue to climb, and they're almost identical in whether it be one locale or another. It might be higher, obviously, but still we're seeing those trends continue, especially since COVID. The thing is that what we have to recognize is that when you are in a heavy state of stress, and that's continuous, that can increase your likelihood of having cardiovascular issues. When you have mental health issues, it's very difficult sometimes to take care of yourself in the way that you need to. Even thinking about what you're eating, being able to feel like you can get up and do things during the day, which then impacts your ability to maintain health and well-being. So, even for myself, like I think all the time, I'm like, man, I've got the extra, 20 pounds on me. It's really 40, but, people say 20. So, but the thing is that, we want to be healthier as a society and a community. And there's many layers to all of this. But the impacts to all of that are being seen through cardiovascular health and our mental health.
Absolutely, absolutely. So listeners, we're going to be wrapping up soon, but don't worry. We're going to be talking about all of these topics much more in depth in our future episodes. But to wrap up, Stephanie, I have one more question for you. If there was one thing that you could fix right now about the maternal health system, magically with a snap of a finger, what would it be?
I would want to see every woman, every birthing person, every dad, every child be able to have a healthy environment where you can live, work, and play and enjoy life and have the access that you really want and need at the tip of your fingertips. Yeah. And that would be accessible to everyone regardless of their health condition, their insurance status, their income, or even where they live. Mm-hmm. That should not dictate whether or not someone gets the best level of care. And so I really want to see that system be fixed so that families can flourish.
Amazing. Amazing. Well, thank you so much for joining us today. We look forward to seeing you again in the future. And thank you, everybody, for listening. Signing off, my name is Ms. Jalen Brown, and you're watching the ReByrth podcast. Bye.